Good morning. I'm Bonnie Gardner. I'm co-chair of the Public Affairs Forum of the First Unitarian Universalist Church of Austin. We're located at 4700 Grover Avenue. Our forums are free and open to the public and occur most Sundays at noon. We welcome your attendance. For more information about our Public Affairs Forum, you can go to our church website at www.austinuu.org. And now, one of our forum committee members will be introducing our speaker, Mimi Garcia. Thank you, Eric Hartman.
Thank you, Bonnie. It's my pleasure to introduce Mimi Garcia, the State Director of Enroll America, who will talk about her organization's work to ensure that eligible Texans sign up for benefits under the Affordable Care Act. There is an initial sign-up deadline coming at the end of the month. That's not the end of sign-ups for the Affordable Care Act, and it's not the beginning of the Affordable Care Act's impact on Texas either, as she will discuss with you. We've had about 4 years now of implementation of this law before this looming sign-up deadline. Enroll America's mission is to help consumers get facts about their health care options and to maximize the number who enroll and retain coverage. Mimi brings a lot to this work. I can understand why Enroll America recruited her for this assignment. She has previously served as Director of Healthcare Organizing for Engage Texas, an Austin-based advocacy organization, and as an organizer with the Texas State Employees Union. She has a master's degree in public policy from Brandeis and earned her bachelor's degree at Southwestern University in sociology and feminist studies. She's going to be talking about the particular challenges of implementing the Affordable Care Act here in Texas, where the governor and other state leaders have done everything they could do, it seems at times, to hinder the implementation of this law. I can attest from personal experience working with Mimi at the Capitol that she is not easily daunted by challenges and impediments that get put in her way. Confronting this particular challenge of implementing the Affordable Care Act in Texas, as you will hear, she takes a good, resilient organizer's approach to the work. I've heard somebody say recently that the way to describe this is start where you are, use what you've got, do everything you can to get the job done. Please join me in welcoming Mimi Garcia of Enroll America.
Well, thank you so much, Eric, for that very kind introduction. And Eric and I have been honored to work together over the last several years on great issues important to Texas, and I was very, very pleased when he invited me to come and speak with you guys today. So I'm going to be giving a little bit both of a look back and a look forward. Just good old PowerPoint etiquette. We'll be starting with sort of talking a little bit more about what Get Covered America is and what Enroll America is. Look back at the first 3 years of implementation for the Affordable Care Act, where we are now in open enrollment. And as some of you may know or may not know, today is the 4th anniversary of the signing of the Affordable Care Act. So happy birthday, ACA. You're 4 years old. What are you doing for us now? And look at the road ahead, what's ahead of us here in Texas and what's ahead of us nationally. And then, as Eric was saying, the enrollment deadline is March 31st. That is 8 days away. And there's still plenty of work to do, and there's plenty of ways that you guys can still get involved to help, the hundreds of thousands of Texans who are trying to enroll and who need to enroll, the millions who need to get coverage, how you can help. So just who are we? This is always a little bit confusing. So Enroll America, as Eric said, is we're a national nonprofit organization. We are nonpartisan. We're non-political, and our sole focus really is on making sure that consumers know about the healthcare options that are available to them now. We have staff campaigns in 11 states. Texas is the largest campaign. It's also, as you know, the largest state with the highest proportion of uninsured. And so we certainly have a big job here that we're doing. And we run, that's our organization website, we run a campaign called Get Covered America. That's really our public-facing entity, and most of the things that we tell people about at Get Covered, we are really focused on education and outreach. We're field-driven, we're volunteer-driven, and we're community-based, working in churches. I was actually just at Congregation Beth Israel earlier this morning talking to members there. We have volunteers from across the state. We've mobilized with more than 300 partner organizations and more than 4,000 volunteers in Texas to get the word out. And most importantly, getcoveredamerica.org is where you can go to get that information about what is a deductible, what is, my premium, where do I go to find help and enrollment, and that's the best place for people to go to get that kind of information. So what's the big deal? Nationally, there are over 40 million uninsured people who would be able to buy coverage through the marketplace. And 7 out of 10 of the uninsured are totally unaware of the financial help that's available to them through enrollment. What is more shocking about that is, though, that 8 out of 10 of the uninsured say that if they could get help paying for their coverage, if they could find an affordable option, they would buy it. We know more and more and more every day, and this was, the initial research said, and it's borne out by experience of more than 8 months on the ground talking to people every single day, that people are not uninsured because they don't think health coverage isn't valuable. People are uninsured because they haven't had an affordable option and a way to get at it. So the Affordable Care Act is a way to help create more avenues towards coverage and also create opportunities to make that coverage more affordable. So the first 3 years, what has happened? On, as I said, March 23rd, 2010, the Patient Protection and Affordable Care Act of 2010 was signed into law, and immediately a number of items went into effect. First, coverage for children with pre-existing conditions. Exactly. On March 22nd of 2010, an insurance company could deny a child who has had cancer or who was born prematurely or who had any number of health conditions, could deny them health coverage, and that was made illegal on that day. Children could stay on their parents' plan until they were 26, which actually helped get about 1.7 million young adults covered in the very first year of the Act. There were no longer lifetime limits on coverage. So if something catastrophic does happen, a car accident or cancer, when they say you have $1 million policy, you can run out $1 million really quickly in cancer treatment. And now insurance companies couldn't say, I'm sorry, you cost too much. We're not going to cover your treatment anymore. There couldn't be any arbitrary cancellations or rescissions on coverage. They couldn't change the game suddenly on you, which was happening more and more that we had heard about before the law was written. And there was a path for appeal on these decisions. And something, unfortunately, that didn't get to last as long as we would have liked in Texas, a consumer assistance program. Here in Texas, it's called the Consumer Health Assistance Program, or CHAP, that was run through the Texas Department of Insurance. And it was really great for the first year, and it lost funding, and Texas refused to pursue additional funding to make it happen. So currently, if you call CHAP, there's a really great 800 number, and people will refer you to someone else with questions. But overall, it created an avenue for getting your questions answered. And something we can't forget about is that there was temporary coverage options for adults who had pre-existing conditions. And that was something, shorthand in the policy world, we called it PSIP, was the Pre-Existing Conditions Insurance Plan. And that is actually being phased out right now because of some elements in the law that make it completely unnecessary. By 2011, we started seeing a closing of the Medicare donut hole. So a lot of you guys, I'm sure, remember when, or were involved, or maybe know about when Medicare Part D was passed and the compromise around being a gap in coverage for prescription drugs for seniors. And every year now, since 2010, the ceiling has come up and the floor has come down on that gap, and so that gap is getting smaller and smaller, that by 2020, that will be closed and there will be continuous prescription drug coverage for seniors on Medicare, which is what that was. Medicare also started providing free preventive services for seniors, and this is also when we start seeing adult coverage starting to provide free preventive services for everybody. So we're talking about annual immunizations, annual well checks, the mammography, things like that are these things that are designed to help keep us healthy by finding out problems early. And I don't know about you, but not having to worry about a $30 copay to go get a checkup makes it a lot easier to go get that checkup. And then something called the 80-20 rule, or the policy name is medical loss ratio, but basically said that health insurance companies needed to spend 80% of your premium on your health. Many health insurance companies, and especially in states like Texas that didn't have any regulation on it, could spend as little as 40% on you, and the rest of it goes to profits. And this is a way to help make sure that that you're getting what you're paying for. So in that very first year, when after the rule went into effect in 2012, consumers in Texas got a rebate that was a total of $167 million because of overpayments in health insurance premiums. Now that is certainly going down because the idea is that you're not going to pay it out in the first point, that keeping your cost low in health insurance. And then something called rate review, that no insurance plan could be raised more than 10% in a year without it triggering a review process on that. Now, nobody wants a 10% rate increase in their life, but we heard many stories, and there was lots of instances of people who would have a 20% increase 1 month, and then 6 months later there may be another 20% increase, and there was no rule to keep that tamped down in Texas, or really in the country. And these are all things that affect insurance plans, the regular coverage plans that people have through their employers. It went into effect early, and these are things that we were benefiting of from 2010 and on. Now, 2012 wasn't as big of a year in new things. Like I said earlier, preventive services for women go into effect. There's a myriad of elements in there, some being, cancer screenings for breast and cervical cancer, well-woman checks, contraception, lactation support, and then also a standardized system for a summary of benefits and coverage. This is something that's super wonky, and if you haven't ever had to discern what your summary of benefits says, it may not feel that significant, but now there's a standard language that has to be used across plans, and the same words have to mean the same things regardless of which insurance plan you have. Seems to make a lot of sense, and I'm glad that it's definitely happening. The other thing that happened in 2012, though, and this is outside the initial shaping of the law, is that we had the Supreme Court challenge to the law. And there were a couple of questions on it. One was, is it legal even for the country to mandate that people buy health insurance and have that individual responsibility? And is it okay for the country to demand that states expand their Medicaid to cover low-income people regardless of whether or not they have children, regardless of ability? And the Supreme Court said, yes, everything is good except for that Medicaid piece. Each state gets to choose whether or not they want to expand Medicaid. And we know that Texas has chosen not to. Which has cost our state a lot in money and has really impacted a bit more than 1 million low-income Texans who don't have a health coverage option now because of that choice. And I'm going to talk a little bit more at the end about where we stand nationally in terms of Medicaid expansion. So, 2013, the state legislature fails to expand Medicaid, but October 1, open enrollment begins. And we can all remember, probably 3, 4, or 5 months ago, that the rollout was rocky, to say the least, and the challenges with the website certainly impacted the ability for people to get through that enrollment. However, by the end of the year, almost 1 million folks had enrolled in state-based marketplaces, and 1.2-ish million had enrolled in federal marketplace. In Texas, We were somewhat behind there. We were at about 90,000, and we have had a big jump since then. And I want to talk a little bit about open enrollment, since we do still have 8 days left. What does it mean for people who are enrolling right now? What is in there? Where can you go? So this first round of open enrollment is the longest round of open enrollment that will be available ever. And the idea is that we want people to get in and have enough time. And we knew that it was going to take, people need last minutes to make things happen. So October 1 through March 31st, you can enroll yourself at healthcare.org, and that certainly many people have done that and made their own choices without help there. You can work side by side with an application counselor, and technically you can also do it over the phone, but at this point I would strongly discourage that because it will be much faster online. And we have a tool on our website at getcoveredamerica.org/locator where you can put in your zip code and you can find enrollment locations anywhere in the country. And you can set sort of parameters on how far out you want to go. We also have a place where you can find enrollment events as well, and there is some information on the table in the back on some enrollment locations and enrollment events here in Austin over the next 8 days that if you or somebody you know needs help, they can go there. And we have found repeatedly that there are really 4 reasons why people get covered and the messages that really work in talking with people about their coverage options. And these are all, get to those core concerns about coverage. One is that there is a simple, easy-to-understand application. Has anybody in here set up an application on healthcare.gov? So it's pretty cool that you can log in. It sort of identifies who you are by using sort of background data and credit check things and stuff like that so that you don't have to provide tons of documentation. So, instead of if with other public benefit systems, you'd have to provide maybe a birth certificate and a social security card and an ID and that kind of thing, you don't need to do that. You can just put your information in. It's one application that'll help you then look at all of the plans that are available in the marketplace. And here in Travis County, that's 83 plans. Now, of course, you want to whittle that down to something more digestible where you can do that as well. But there's one easy to understand application. You may be able to get financial help with the cost of coverage, and this is very important. 83% of those who have enrolled in coverage already have gotten help paying for it. We anticipate in Texas of the 3.2 million Texans who are eligible for coverage in the marketplace, that about 75% of them are eligible for financial help. And because we know that that's the big barrier, we want to make sure that people know and give it a chance, give themselves a chance to do that. Plans will cover the care that you need. And we'll talk a little bit in a minute about what's called these 10 essential health benefits. But for too long, people would end up, especially people shopping in the private market, would end up with these high-cost, low-coverage plans that they felt that they were covered. They'd get, something would happen, and it turns out that they didn't have coverage for the emergency room or for that surgery or for whatever, and they were stuck paying for it. So having the protection of these essential health benefits helps make sure that you're getting a quality plan. And then this is huge. It doesn't matter if you've been sick before. And it can be something as minor as a broken bone or as major as cancer, chronic illness, anything like that. It doesn't matter. If you've ever signed up for an individual plan and had to do a physical and had to submit blood work and do all of that kind of thing, this doesn't happen here because those things don't apply. So, and it won't impact the cost of your plan, and it won't impact the kinds of services that you can get. So those 10 essential coverages, they include doctor's visits, hospitalization, maternity care, and newborn care, which I have to say, I think I can still consider myself a new mother. My daughter is 15 months old. That having a individual plan that had maternity coverage was unheard of before. Emergency room care, prescription drug coverage, lab services, preventive care like immunizations, checkups, got my cholesterol checked recently and didn't have to pay for that, which was nice. Rehabilitation services, and also something called habilitation services. So if you are caring for a young person who has developmental disabilities, it's the therapies that can help get them to a higher level of function. Mental health and substance abuse treatment and pediatric care. So pretty comprehensive plans. So it's 2014. Our wonderful law is 4 years old, and there's some great stuff happening, and there's still some things that need to be improved. We knew that this wouldn't be the end of the conversation around health reform, but the start of a new conversation. So just some benchmarks here in 2014. As of March 1st, a little bit shy of 300,000 Texans have enrolled in a plan, which means for Health and Human Services speak, it means that they've gone through the entire application and they have selected a health plan. About twice that many have actually gone through the application and are sort of stopped at that point of making that decision around a health plan, because it's a big decision and you want to make sure that your doctors are in it, you want to make sure that your drug coverage is being there, and so it makes sense to take a little bit of a pause. But we are right now following up with everybody and saying, you have 8 days left. It's time to pick a plan, because we don't want anybody to get left out. In mid-March, early last week, I think it was, or maybe it was the week before that HHS actually said that since those numbers through February had been released nationally, about 5 million, a little more than 5 million, which had been an uptick of about 1 million in about 2 weeks, had enrolled. And we're seeing more and more in the enrollment centers around the area and really around the state that everybody has a fire lit under them, and it's that last-minute push. I admit to being like an April 14th tax filer, so I think it's like that. And so we had an enrollment event in McAllen where we had 500 people there, 500 families waiting to enroll, where any other large event that we had done there had about 300. We did a bus tour a couple of weeks ago where we got to go with our national president and some other folks around the state in this very garish, colorful wrapped bus. And having been at this library in McAllen, they normally see about 25 people a day, and the next day they had 100. There's a huge need, and people are wanting to get enrolled, and it's just kind of a frenzy right now. Open enrollment ends a week from Tuesday. And the next open enrollment period starts in November. So November 15th to February 15th, they actually just extended it by a month, is the next open enrollment period. Now, I know that a lot of people may have questions like, oh, I'm insured now, but my company's going through a merger or something may happen, and what if I get married? What happens there? There is something called special enrollment, which is if you have a life-changing event or some kind of qualifying event, you can enroll. And I think you really only have about a 30-day window, but that you do have that opportunity. So if you lose coverage, if you have coverage right now and you lose coverage, or a birth, a death, a divorce, those kinds of things, kind of anything that you would generally get with a job. The other big thing here, especially in Texas and where we stand with Medicaid expansion. So it's probably not the easiest thing to see out there, but I will describe to you that there are 28 states plus the District of Columbia who have expanded Medicaid. So we're at more than half. About 5 are currently debating, and it looks like governors or legislators may make that move. And then there are another 17 who are, it's not on the decks right now. It hasn't happened, and sort of not surprisingly, it's a lot of our southern states. And Texas is the largest state, that hasn't expanded Medicaid. This impacts our state greatly. Like I said, there's about 1.2 million low-income Texans who, if we had Medicaid expansion, would qualify. And the other thing that happens is that we get a pretty tremendous return on our investment if we do it. The federal government will match it At the smallest, the match is $9 out of $10 that we spend on Medicaid for this population. And there are some great organizations who are working on getting Texas to expand Medicaid. Enroll America, our focus is making sure that people who have a coverage option right now, that they're getting covered, because we know there's about 3 million who could get enrolled, and right now there's only about 300,000 of them who have done it. But groups like Texas Well and Healthy and Texas Organizing Project and some others are working very hard to make sure that Medicaid gets expanded here in Texas. So there is still time to get involved. Back there is on the table, there is a card that looks like this, and it folds and detaches. And we are having volunteer phone banks every day through March 31st. We have been using these cards to talk to now about 20,000 people who said, I don't have coverage and I want to get connected. Please help me get connected. And we've been calling and calling and calling, and a lot of them have gotten insured, but a lot of them still, they keep putting it off, or we just haven't been able to talk with them. And we need tons of volunteers to help us make those phone calls. If you fill out one of these cards and click volunteer, check, I guess I should say, volunteer, then we can get you scheduled for a shift phone banking to help make this happen. In some ways, we're sort of like in GOTV mode, like it's GOTE, get out the enrollment. And we do our phone banking. We have one phone bank at M Station over on MLK and Airport area, and we have another at our office down south, which is on Ben White. And we would love everybody to get involved in that. The other thing is this flyer that has the enrollment locations here in Austin. And if you have friends and family or people you know elsewhere in the state or around the country, that you can refer them to our website for locations on where to get covered. But share with them, you have 8 days left. This is the time to get covered. This is the time to make it happen, and there's no more waiting. So with that, I would love to just have a conversation, answer questions, and leave it there. And that's my email up there.
Thank you, Mimi. Well, let's get to questions then. Would you say your name?
Tom Didek. Thank you for your presentation. My question is, are colonoscopies covered under the preventative?
Yeah. So a colonoscopy is considered a preventive screening. There are certainly timelines about when they're supposed to happen and if it falls within that. Now, there's an important distinction is that there's a difference between preventive screening and diagnostic screening. And this has actually come up a lot in questions around mammography. So, but we'll just use colonoscopy as an example here. So if you have never had any sort of colorectal issues, and your colonoscopy is coming as part of the general maintenance and screening that happens because you're taking care of your health, then that's considered preventive screening. If you have had, either a prior colonoscopy that shows some kind of area of suspicion or some kind of treatment that may have to happen from that, or colorectal cancer or Crohn's disease or something like that, then those colonoscopies are considered diagnostic and part of the treatment, and so those aren't covered as part of preventive care. But just your regular screening should be covered. We have run into problems, however, and this is where I think consumers should be self-advocates and may have to fight a little with their insurance companies, is this desire to split hairs. So it'd be like, well, the colonoscopy is covered, but the radiologist or the whomever who has to read it may not be covered. And that's, that is something that we have brought up as a concern, and other groups have brought up as a concern, and that's something to definitely advocate on if you're seeing something that is showing up weird in terms of charges. Yeah.
We have a question from Douglas Bauer.
First, I wanted to thank you for an excellent presentation. My question has to do with the flack that President Obama has received because of the comments that you could keep your old substandard health care plan. And some situation is true, some it isn't. I was wondering if you could comment on that.
Yeah. So just so everybody's on the same page here, the whole scandal about if you like your plan, you can keep it. And it turns out it should have been like, if you like your crummy plan, you're probably going to you can't keep that. If you had the same plan from the day the law was signed until now, and it hadn't made any changes, then that falls under a grandfathering clause, and you can hold on to that plan. But because the law makes all of the plans have to be better, essentially have to cover those 10 essential health things, insurance companies could no longer provide those crummy plans that weren't covering the things that needed to be covered. So what happened was a lot of insurance companies said, because of Obamacare, you can't keep your plan, and here is another plan that complies with the law, and it would be like monstrously expensive. And the thing that they left out of their letter was that you can actually go to the marketplace and shop for another plan and actually use some like good old-fashioned free market competition to keep your costs down. They were just showing them whatever plan. And a lot of people who fought their insurance company on this got a better rate. And we talked to a lot of people and said, hey, go to the marketplace and you can probably even get a better plan that's cheaper than what you've been paying. I think it got in the very toxic politics that have surrounded this law. There's been a desire to latch onto anything that could be problematic and probably oversimplified talking points that led to it. The administration has said, though, that if you have gotten one of these notices and you haven't changed your plan, they've actually given a year extension. So if you want to stick with that plan, you can stick with that plan, and the insurance company can still sell you that plan. But we're encouraging anybody that if they have a private market plan, that they should just take a look at what's out there, because they may be able to get help paying for it, because you can only get what's called the advanced tax credit, which is the credit to help make your plan cheaper. You can only advance it if you go through healthcare.gov. You can only get essentially a monthly discount if you go through healthcare.gov. And so it probably would make your monthly payments cheaper just to go there and check it out. But yeah, that's the whole thing on it.
We have a question from Chris Cunningham, and Chris was the chair of the forum for 25 years.
My question is the main, if you're just talking to somebody from another state or somebody who just hasn't gotten around to anything and you can't remember this, you just get covered America. You just go to healthcare.com?
So it differs. So about half of the states are at healthcare.gov, and then about half the states have created their own marketplace. So at our website, Get Covered America, we make those distinctions because, like Illinois, for example, they have a marketplace that's a partnership between the state and federal. So I prefer to send people to our website, but healthcare.gov in about half the states will be where people go to enroll.
And my second question is, what if you don't sign up this time, but you want to maybe sign up later? What's the situation with that?
Yeah, so if you are uninsured right now and you choose not to enroll in coverage by next Tuesday, you probably won't get another opportunity until November 15th of 2014. And there is this penalty, the individual mandate. And the way that works is if you are uninsured for more than 3 months during the year, then you will have to pay a fine that can be up to $95 as an individual or 1% of your income, whichever is greater, up to $285. So it could be up to $285 as an individual, a fine that you would pay when you file your taxes. So if you decide not to get insured right now, you'll have to wait until November as your next option, and you'll probably have to pay a fine in your taxes when you file them for the 2014 year. The other thing to remember, too, is that the penalty is it's $95 or 1% per adult in the family, and it's $47.50 per child, or 0.5%. So if we're talking about a 4-person family with 2 children and 2 adults who are not covered, that could actually become a pretty significant fine, and you don't get anything for it. I mean, you don't get health care necessarily for paying that money, and you may be able to find a better option in there.
Yes, I recently spent 6 years in Oklahoma, which is even more right-wing than parts of Texas. Obama never carried one county in either election.
Wow.
I have a friend in North Tulsa whose mother was a survivor of the 1920s race riot there, and she spent the last 10 years taking care of her mother and her father until their deaths. She had never had employment during that time. She's had a very difficult time finding a job, working at a call center, but she was easily, and she had a lot of pre-existing health conditions. She registered and got insurance quite easily online, and she got a Blue Cross plan that I believe included dental and vision for $80 a month.
Wow.
Terrific. But then the call center laid off all the people there, and her policy was canceled, and she was offered an alternative policy that was about 3 times as much. Have you ever heard of anything like this? I mean, that makes no sense.
So she had just to clarify, she had a policy that she had gotten through the federal marketplace, or she had gotten it from her thing? Just with any private insurance, if you don't pay for your policy, you won't have coverage. So there are more grace period windows now than there used to be, because it used to be if you didn't get your premium payment in on day 1, by day 3 your policy was canceled. And now there's like a 30-day grace period, and then like another 30 days before they can cancel. I haven't heard anything specifically like that, but there are some appeal processes that I would encourage her to look into, and I can't really speak to Oklahoma specifically. Yeah.
Okay. I'm hoping that there is some way when you go online and do the application process that you can pick from a series of things that are important to you, so you don't have to read through 83 plans.
Right.
Okay, good. Yeah. And there was something. And as part of that process, will they consider helping you financially, or is that a separate application process?
So the one application is where you find out about what financial help you may be eligible for. And so I didn't speak very much detail to what that looks like, but so the tax subsidies, what it basically is like a tax break. And so you can choose. It's based on your income and how many people are in your household. It's sort of based on your tax filing unit. And you can choose whether or not you want to advance that tax credit. And so it's an estimate that would pay to the insurance company to help bring your costs down. So say you are told, and it's purely hypothetical, that you are eligible for $150 of a monthly tax break around this tax credit. And you could take it monthly. Actually, let's make it $100 because that'll make my multiplication easier later. $100. And you choose a plan that costs $200. And so they'll pay directly to the insurance company that $100. So all that you pay is the difference, which is $100. Now you could say, no, I don't want to advance it. I don't want to make my monthly premium smaller. I'd like to take it all in one lump sum when I file my taxes in 2015 for this year. So you could get a return of $1,200. That would be the same kind of thing. It's important to note that that advanced tax credit is an estimate based on what you estimate your future earnings to be. And there is some wiggle room. So there's some forgiveness area that if you end up making more and you don't qualify for as much of a tax credit, or you make less and you qualify for more of a tax credit, there'll be a sort of a settling up time in your taxes. it won't be a situation where you'll be on the hook for a lot more money, but you could get a better return based on that. So that's probably a lot more answer. But that's basically how. And so that one application determines your tax credit, the estimate there, and then that's the place where you can go and shop for the plans, which you can narrow them down. Yeah.
Peter? We have a question from Peter Ty.
I've enjoyed this very much. I'm asking a fairly specific question. I have a 32-year-old stepdaughter who lives in Hays County, who is presently unemployed and therefore uninsured. What's the best way for her to get a policy in the next 8 days? Is it to use healthcare.gov? She's got good computer skills, but she's not too terribly focused. So what would be my best approach, would you say?
Yeah, so if she's not terribly focused, it's less complicated than other, like prior applying for insurance has been, but it's not like, a walk in the park. It can take about an hour to an hour and a half, maybe 2 hours to go through the entire process. So if she wants to sit down with someone, there's, in Hays County, I think actually Communicare is a community health center who has enrollment assisters on there. And there are some other locations that I just don't have off the top of my head right now. But at getcoveredamerica.org, you can use the locator. She could use the locator there to find a place. If she's unemployed, is she currently collecting unemployment?
No.
Okay. So I would have her sit down with somebody and talk through that because it's kind of a unique situation. If she anticipates being employed within the year, then she'll have an income stream that would be able to use in that application process. But everybody's situation is different. So I think it would work for her to sit down with an application counselor.
Okay. In Hays County?
Yes.
And she can find that on GetCare?
GetCoveredAmerica.org.
We'll allow her to locate that. Thank you.
Okay, wonderful. Thank you.
Thank you, Peter. Do we have any more questions? Okay. Several more. Nancy Bellows.
Well, as long as he brought up that case, I have a son who's unemployed and could be getting veterans health care, but have had trouble getting him to sign up. So my question to you is, what are the implications, since the penalty seems to be a tax thing if a person is unemployed?
Right. That's a great question, and I don't know that I will be able to answer this to your satisfaction, but there is something called a hardship waiver. So, and this is especially true in states that have not expanded Medicaid, and what that looks like for somebody who, in, let's see, a Medicaid expansion state, Arizona has Medicaid expansion, and so an individual who's making $11,000 a year, they would qualify for Medicaid. But here in Texas, they don't qualify for anything. And the mandate says, if there's an affordable health care option for you, then you need to take that. And that affordability is considered 9.5% of your household income or less. And if you can't find a plan that meets that, you can get a hardship waiver that exempts you from having to pay it. So automatically people who are in that Medicaid gap, so who are making here in Texas less than around $11,500 a year for an individual, then they would qualify for that hardship waiver. Now, you don't actually have to apply for that right now. They can apply when they do their taxes in 2015 for 2014. But the point is, people want health insurance. So I think if he's currently uninsured, unemployed, and is eligible for VA benefits, then that's probably like the thing that he should pursue. Because having VA coverage, having TRICARE or something like that, actually counts as credible coverage, and then he'd actually have some health coverage options. If he doesn't have income right now and can't afford a plan, then he won't be on the hook for the penalty. but he won't have coverage. So.
There's another question in this area. I saw another hand? Okay.
Michael Vargas, and I have a personal question since other people have stood up. I decided I would too. Well, my son just got a new job, and he does qualify for health insurance through that job, but he has no idea what it looks like right now. Would that in itself give him the right for the extension?
No. So if he has an offer of coverage right now, then
he hasn't seen it.
Right.
He's having a hard time,
getting all the details.
All the details. Yeah.
Yeah. So the real question here, or the question I think I'm hearing is like, should he apply right now?
Yeah.
Or like if this coverage doesn't look good, could he apply for other coverage down the road?
Right. Well, and it's a little more complicated than that because he has a son who he wants to get covered through the system. Could he have insurance through his employer and his son?
Yeah. So
have coverage through the system.
It's hard to say specifically, not knowing all of the elements of it. But I will say this: if you have an offer for coverage through your employer, that means that you're not eligible for the tax subsidies. Like you need to take that offer of coverage. If you don't like that coverage and you want to buy something in the marketplace, you can do that, but you're not going to have the discounts available to you. You'd just be paying it altogether, like paying it outright. It would depend on your son's income that his son may be able to qualify for CHIP, which is the Children's Health Insurance Program, which may be, a better value than, sorry, my computer is about to reboot itself. A better value than doing with the employer. But I mean that's something where I think it makes sense to sit down and look specifically at all of those factors.
Okay. Yeah. I'm afraid he isn't going to have all the pieces in time, but okay. That's life in the real world.
Yep.
Thank you.
We have a question from Marge Wood.
What if you have no money and you have a wreck or get really sick or something, or maybe your kid is sick? Are the doctors going to help you, or are you just out of luck?
So it's much the same situation as it's always been, which is that hospital emergency rooms, if they get any kind of federal funding, which most of them do, then they have to see people with an emergency regardless of their ability to pay. That doesn't mean, though, that they won't get a bill down the road. And that's actually something that is one of the biggest drivers of our healthcare costs is people who are uninsured, who have issues. They go to the hospital emergency room. They're not able to pay for it. They end up in a bankruptcy situation or something like that, and the hospital ends up with that money like on the books, and it gets redistributed to everybody else and drives our prices up. But yeah, it's much the same situation that your options are community health centers, sliding fee clinics. It doesn't help with things like prescription drug coverage, that kind of thing. And we here in Texas, though, for children, there are options for coverage through Medicaid and CHIP. It is difficult sometimes to find doctors who will take new Medicaid patients, especially because the state has dropped how much they will pay doctors who see Medicaid patients. But it will continue to be much the same situation as it's been forever, really.
We have a question here from Felicia Conjable.
I have a two-part question, and the first part's a little bit vague. I heard on a program on public radio a piece, and I heard a piece of the piece, about how emergency rooms might start offering more kind of preventive care. You haven't heard anything like that? Because I was wondering how that would tie in, and maybe it has to do with Medicaid patients or totally uninsured, to cut down their costs for extreme care.
Yeah, there is actually, so something that I didn't talk about in talking about like what's happened in the 3 years prior to where we are now, is that the ACA has helped pay for some experiments around cost containment. And so in Medicare and Medicaid, the costs are often 20% of the people are accounting for 80% of the costs. And that's true in health insurance in general. And so they're trying a number of experiments to try to keep people out of the emergency rooms and have more treatment for chronic diseases. And so, for example, in New York, they about 2 years ago started an experiment where they were paying. They basically told the hospitals, we're not going to pay for readmissions. We're not going to, if somebody within 30 days. So if someone comes in and say it's like high blood pressure situation, and then they come in again a week later with the same thing, and it's a Medicaid person on Medicaid, then they're not going to pay for that second hospital visit. So the hospital said, oh no, we should try to keep that person from coming back in, and not say, no, you can't come, but how can we keep you healthy? And so those have been some of the things that have been tried to help keep costs down across the board.
The other question was, when this whole healthcare thing was about to happen, was that there wouldn't be enough doctors to go around if everybody's insured.
I think that's a real concern, and that actually comes in that realm of, I said that the ACA didn't solve all of our problems. It sort of just started a new conversation. And Texas has actually been experiencing a doctor shortage, and that has been a concern, is that if suddenly folks have the ability to have regular care and regular coverage, are there enough doctors to serve them? And those are some of the things that are, I'm sure, going to be ahead of us as questions, if that is the case. And certainly, I think reforms around primary care payment and how that whole thing is structured in medical education are going to have to be sort of next on the discussion list.
Mimi, I have a question for you, and just to see if you've heard any kind of similar comments. As a practicing psychologist, I've heard so much misinformation about Obamacare and scapegoating of Obamacare, and we have seen increased patient co-pays for mental health, increased deductibles, and I've heard about increased premiums for companies buying policies for their employees, and all of that is being blamed on Obamacare, and I don't think that that's realistic, especially since we pick up the Wall Street Journal and we read that all the insurance companies are now making record-breaking profits.
Right.
But there's been so much scapegoating of Obamacare, which is unjustified.
Yeah, I mean, I would agree on that. I think that we've actually seen, healthcare costs, healthcare spending has been going up at a tremendous rate for decades. And in the last 4 years, we've actually seen that sort of trajectory start to get shallower. So we're not at a point where healthcare costs are coming down, but where it's sort of rising less quickly. And that really is in large part due to some of the cost containment factors, some of the like 80-20 rule that says that insurance companies actually have to pay for your care and can't charge patients more. It's really hard to say that like this one thing is what is contributing to the cost of things. It's a very large and very complicated system, and the costs have been going up. They are going up less quickly. And again, I think that is an area that is the next realm of things that have to be addressed is what happens with cost containment, what happens with how we're actually paying for things like drug development and treatment development and that kind of thing.
Yeah, the irony is that while the insurance company profits are going up, payments to doctors are going down. So where is the money going? Are there any more questions from the audience? Douglas.
Earlier in your presentation, you mentioned that in Texas there are dozens of possible plans available as part of the Affordable Care Act. Is there a single summary sheet available somewhere on the website? And if not, how does one start from, 50 plans and try to pick one that's suitable for you?
Yeah. So the plans are actually set up by smaller geographic regions than Texas. So it actually depends on which county you live in. So in Travis County, there's like 83. In Bexar County, there's 72. In some of our more rural counties, there's less selection because there's less providers. You can, if you want to window shop, essentially, you can go to healthcare.gov, and there's like a little window shopping button, and you can put in where you live and some basics about yourself, your age, how many people in your family, that kind of thing. And it'll pop up the plans in your area that you can start to narrow them down, and it'll give you some estimates on costs based on the information you provided. Now, those estimates are just like the straightforward cost that doesn't include any kind of tax subsidy that you might get to help pay for it. So it's just straight up cost on it. But you can take a look at that and see what's in there, and then you can read the plan descriptions and see what's available. You don't get the very detailed plan descriptions until you go through and you create your account and you do all of that, because you can't purchase through the marketplace without having created your account and that mechanism with which to make that purchase.
Mimi, would you like to make about 1 or 2 minute closing statement?
Sure. So again, I just want to thank everybody for having me here this afternoon. And I think that one of the most important things right now is we all, if not ourselves, know somebody who is uninsured, that this really is a historic opportunity to get covered, to have some of the safety and security and peace of mind that comes with that. And I would invite everybody to come join us for a phone bank this week. It's actually some of the, if you've ever been involved in phone banking, it's actually probably the most satisfying calls you can ever make, because they are people who said, yes, I want to get covered, I want to get insured, I need your help, and we'll train you and we'll help you do it. So thank you so much.
And thank you, Mimi. Thank you for making something that has seemed complicated much more accessible to us. And I think the Affordable Care Act will be recognized as one of the great social achievements of the decade, if not the century. So thank you for an important talk.
Thanks, guys.